This talk is about Chapter 5 in Global Health 101, and it's about an introduction to health systems. And this talk is very important because this is probably very different from any of the talks you had in your undergraduate associate degree nursing program or in your diploma nursing program. And because we're going to talk today about the main functions of the public health system, major organizations assisting in global public health work, and then the cooperation between the private sector and the government. And so understanding how the health system works and what affects it is very important, especially when you're voting and looking at policies that our Congress is putting forward and how other countries are going to be affected. So what is a health system? It's the money that finances it, it's the provision of preventative health services, it's clinical services, it's specialized input, education of the healthcare profession, the production of drugs and medical devices, and agencies that plan and fund and regulate health. So it's all encompassing. It's not just the clinic system, but it is everything involved: the education, the medication, and the providers. The function is to provide good health, be responsive to the expectations of the population, and to be fair in its financial contribution to the economy. And so that becomes very important in countries that have limited amounts of money. When we look at the healthcare pyramid, this is the way that a country should be handling its healthcare. So we see public health, which is the health promotion and disease prevention, should be the biggest aspect, where the most money is spent, which then would spend less on primary health care. We know people still get sick. We know people still need to see family doctors and internists. And then the smallest section should be the specialty care. But actually in the United States currently, this is a reverse triangle. We have spent very little money on public health. We spend a lot of money on primary, and we spend a tremendous amount of money on specialty care. And it seems like a broken system, which is what they talk about being. So we have 3 levels of care. We have the primary, secondary, and tertiary levels of care. Primary is the first contact with the primary care doctor, who is the gatekeeper, who's keeping an eye on the services that the client needs. The secondary level is the specialists and general hospitals. So specialists within there, such as the emergency room, surgeons. But then the tertiary are the specialized hospitals: the children's hospital, the cancer hospital, the orthopedic hospital, where tertiary services are provided. And it's much more noticeable in other countries than it is in the United States, those 3 levels of care. So the public health system then seeks to ensure that the health of the community is protected and promoted. It sometimes overlaps with the primary care system because they do similar actions, screenings, and providing vaccinations. The public health system is mandated through law in most countries and can involve the federal, state, and local systems. And this is global as well. Factors that influence healthcare are the consumers, whether they're purchasing healthcare or whether they have insurance; the employers, who are the purchasers of the insurance or not the providers of insurance; then the healthcare system, which accepts and sets the prices for the services; legislation that can mandate the provision of insurance or the provision of services to people, such as emergency rooms and post-disaster relief; and then the politics. Politics can greatly influence healthcare, as we can see in our current situation in the United States, but we can see it in other countries as well. So primary health care is essential services and universally available. Should be universally available, and most developing countries do have these primary care services available. It's preventive services, it's to promote health, it's curative, and it's rehabilitative, which is all that the United States has, but other countries have as well. And then the public sector is responsible for raising the funds for the health system, making decisions about allocating those funds, and establishing approaches to health insurance. The private sector then is the for-profit sector, which is involved in the provision of services and the operation of health clinics, hospitals, services, and laboratories. Private sector, so it's owned by a person, an entity, instead of being a governmental service. And usually the private sector and the public sector work together, typically in all countries. Then we have the NGOs, which is the non-governmental organizations, typically private philanthropic agencies that go into communities and promote health, promote sanitation, provide healthcare services. Doctors Without Borders is an organization, the Smile Train, where people, physicians and nurses go in and do cleft palate repair. Those are NGOs that can go in, and sometimes they work with the public sector as well. So the health sector issues involve demographic and epidemiological changes that can change the need for services. If you have a lot of elderly, you might need more services. If you have a lot of babies, you have a different need for different services. Quality of care is an issue. Universal coverage is an issue. Access and equity are issues in the health sector. Again, demographic and epidemiologic changes can be if you have people who are living longer in a society, then the society faces a greater burden of non-communicable diseases such as arthritis, diabetes, heart disease, and the cost of treating these conditions can be high because of the follow-up required. And again, we talked about poor countries facing that burden of communicable diseases and non-communicable diseases, as well as injuries. Primary care services that become important are, in some countries, malaria prevention and treatment, tuberculosis treatment and prevention, HIV prevention and care, long-term medication management, maternity-related intervention, childhood disease interventions. This is all where the primary health care system becomes very important in countries. Future challenges include that cooperative surveillance, again, between countries, and prevention and treatment of emerging conditions, working together to strengthen the health systems, focusing on evidence-based actions and results, and sharing results, financing initiatives that will help neighboring countries, and leveraging public and private partnerships. Those are in our future so that we can work together to solve health problems. I want you to take a look at this table 16-8, which is on page 465 of your book, and just think about factors that are associated with positive outcomes. We talked about some of these simple and flexible technologies and approaches that can be adapted to local conditions that don't require complex skills. I know that the Gates Foundation supported laptops that work on solar energy, and if you can imagine that a healthcare worker, a nurse out in a rural area that could have access to the internet and a solar charged or through the phone and a solar charged laptop to look things up, how that would improve the health in certain areas. And so take a look at those and think about where the public health nurse can assist, asking for funding, getting households to participate, and providing leadership and witness to governments on services that are needed. Thank you for listening.